Dr. Amish Adolja, Senior Scholar at Johns Hopkins University Center for Health Security, and Dr. Catherine O'Neill, Chief Medical Officer at Our Lady of Lake Regional Medical Center. All right, Dr. Adolja, I want to start with you. We know the U.S. is averaging more than 386,000 cases a day. Hospitalizations haven't risen as much. We know those numbers usually lag case counts. So from what you are seeing, do you think the healthcare system could be overwhelmed in the next few weeks?
I certainly think that there are certain regions of the country where there are high-risk people that are not vaccinated, where you're going to see hospital capacity compromised. These hospitals are already being crushed with Delta patients. That's been going on for the past couple months, and they have staffing shortages and they have staff out sick. So what we'll likely see are regional parts of the country having difficulties with maintaining hospital operations, and that's where the federal government assets may come in very handy. Systemically, I think we won't hit anything like what we saw a year ago at this time because so many people have been vaccinated. We have many more tools. It's not the beginning of the pandemic. It's sort of a new phase because over 200 million people, 61% of the population, are fully vaccinated.
And Dr. O'Neill, Louisiana is one of the few states where hospitalizations have risen by at least 50% compared to last week. I do want to note that is nowhere near the peak your state saw in the fall. So what are you seeing right now in your facility?
What we're seeing in our facility today is a tripling of admissions over the last week and a tripling of ED visits. And so the combination has caused us to be very scarce in our number of tests that we have able to provide to patients as they come in to seek care. Then when you come into the doors of the hospital, what we're seeing is that, as we heard earlier, our vaccinated patients are getting sick and our frail multiple comorbidities vaccinated patients do need admission, but their admissions are shorter and they're able to leave the hospital after several days. Our unvaccinated patients are the sickest patients. They're the patients most likely to be on the ventilator. And because we are a state that does not have high vaccination rates yet, we're seeing those admissions increase this week as well.
Are you concerned you could reach those peak hospitalization levels again? And if that happens, are you prepared?
We're concerned that we may not be able to take care of patients the way we want to take care of them by tomorrow. So we're running out of tests, we're running out of room, we're inundated in the ER, and we're wading through people who have flu-like illnesses who are very concerned and feel terrible with Omicron to try to find the sickest patients and get to them as quickly as we can. In the meantime, just like you're seeing around the country, we have lots of people out with Omicron, with other flu-like illnesses. We do have a lot of flu here right now. And so the ability to staff the hospital is one of the things that we've consistently said through the pandemic is an issue with offering great care, and we're seeing that come to a head now. So whether our admission rate hits last winter or not, we're at a point in which we are wondering how good is our care today, and can we offer great care over the next week? And that's our biggest concern.
A great question. Well, Dr. Adolja, many experts are warning that this wave is going to get worse before it gets better. So when they say that, what exactly do they mean? How much worse could this get?
Over the next couple of weeks, we're going to see increases in cases, probably record-breaking, because Omicron is something that can get around the immunity provided by prior infection and the immunity provided by vaccination. So cases are going to go up, and they're going to be disruptive as people have to take 5 days off, as people are sick and they have to call off from work. That's going to be very disruptive. And we will see hospitalizations increase. And as I said earlier, it's going to be regional where we see problems. It probably is not going to be systemic, but it's going to take some time for us to get through this Omicron wave. It's going to take some time for testing to get into place, and it's going to take some time for people to have access to the Pfizer antiviral. All of those things are going to tame the virus over time, but the next couple of weeks to months are going to probably be rough. Not as rough as last year, but rough. And I think it's in many ways frustrating because what's happening now is largely preventable, because this is really the unvaccinated that are causing our hospitals to have capacity problems, and that makes it much more tragic that this could have been forestalled or prevented if more people would have been vaccinated.
Dr. O'Neill, the CDC's updated guidance, I want to talk to you about that. They're saying that they have this new isolation guidance for people who have tested positive for COVID, saying that people can stop isolation after 5 days if they don't have symptoms or if their symptoms are resolving, as long as they wear a mask for the next 5 days. Do you agree with this? Because much of this seems to be in response to staffing shortages, not just in hospitals, but in other sectors. Are we sacrificing good health practices just to make sure there are enough people out there to keep the country running?
I absolutely agree with shortening isolation. We know that there are many, many people who don't shed for 10 full days, and those people tend to be vaccinated people. Greater than 90% of our healthcare employees in our hospital are vaccinated. Many of them got a test asymptomatically to see their family and do the right thing. And we know that those groups of people do shed less and are safer to come back at 5 days. But when you look at people across the country, you really have to ask yourself, what is your motivation to get out of isolation at 5 days? If your motivation is because you feel truly well, you're vaccinated and less likely to shed, and you can come back to work with a mask and keep that mask on, then that's the right thing to do. If your motivation is to go back to work without a mask, to see lots of people, to go to a gathering, that's not the right motivation to get out of isolation early. And so we put this back to the public to say, we really need to do the right thing. And if you're not feeling well, you need to continue to isolate for 10 days.
And Dr. Adolja, I also want to get your take on this revised CDC guidance. Obviously, on social media, people are having a field day with this change in guidance. So what's your take?
We've always known that the 10-day isolation period it's a one-size-fits-all solution, and not everybody sheds for that 10 days. And while we're seeing lots of breakthrough infections that are mild, and we reassure people that this is a mild illness, the fact is, having to take 10 days out of work is very disruptive to people's life, especially if in those last several days, this isn't something that is going to pose a danger to others. So I think that this was the right decision by the CDC. You can actually couple it with testing to even be even more precision guided. But you also have to remember that many people weren't even following the 10-day isolation period. So you also have to keep in mind that if you give someone something they can't do, they're not going to do it. So I think that there's an element of harm reduction here. We're trying to reduce the harm the virus causes. And if we can get people to isolate for 5 days, that's much better than people not complying with the 10-day isolation period. So I think this was the right move, and it's part of normalizing this virus, because it is something that we're going to be dealing with for decades into the future. And we have to have a sustainable approach to this, because we can't really avoid it anymore, because this is an endemic respiratory virus.
Absolutely, and here for its third calendar year. Now, Dr. O'Neill, let's take a listen to what the World Health Organization said about what this year could look like.
The acute phase of the pandemic that's been associated with the tragedy of deaths and hospitalizations, that can end in 2022. The virus itself is very unlikely to go away completely, and will probably settle down into a pattern of transmission, low level, causing occasional outbreaks in under-vaccinated populations. And we hope that that is the end game here, but we're certainly not there yet.
So how exactly do we get there to the end game? What do you see happening over the next few months?
The end game has always been very clear, and maybe we haven't been clear about it, but to get to the point, and that's a very hopeful message, that we have endemic spread only, that this virus turns into a pattern that is somewhat controllable, means that people are vaccinated, that we have testing available, and that when somebody becomes sick, that we mitigate that through masking and through making sure that less people get it each time. The first part is vaccination, which we've had for a year, that we're still not well vaccinated enough, and that's why we continue to see these surges that cripple our healthcare system. So I do think that's a hopeful message. I think we can get there. I think that we have to do our part by vaccinating people, by having enough testing, and by mitigating those who are sick.
Well, doctors Amish Adolja and Catherine O'Neill, thank you so much for joining us with your expertise.
Thank you.
Thank you for having us.
And this just into CNN.